Welcome, welcome. Hello. Mic testing 1, 2, 3. Hello, hello. Mic testing 1, 2, 3. Hello, hello. Mic testing 1, 2, 3. Hello, guys. Welcome back to the live. Hello guys, welcome back to the live.
Hi guys, please join to my live.
Please join my live.
Welcome to KP's Health Hub Official. This is my first live section. So if you anyone find in the YouTube, please connect to this YouTube live. Then I will quickly go through the ABG interpretation and components of the ABG. If anyone joined from the medical history like nursing staff or any paramedical staff, so comment your name and do the subscription. Then you can find the good content from my side. So did anyone join from Vijayawada or Hyderabad? Namaste to all and warm welcome to everyone who is joining on the live Campus Health Official. So please connect quickly, then I can start my presentation. I will interact with you all in the chat box. So if anyone joined from the Vijayawada, you can put your comment in comment section. So, Namaste and warm welcome to everyone joined in the live section. KP's Health Official. I'm so glad you are here. Today's section is all about one of the most important life-saving diagnostic procedure in the healthcare field and healthcare sector. That is nothing but ABZ. ABZ is nothing but arterial blood gas analysis. Whether you are a nursing student or healthcare professional or just someone passionate about the medical science, this section is designated to give you depth knowledge about the arterial blood gas analysis. Right from it is basic principle to real-time interpretation. Before I begin, please do not forget to like, to stream and share it with your friends and classmates. And if you haven't already, subscribe to KP Health Hub Official for more informative sections like this. Let's get started. So, introduction of the ABZ. So, ABZ is nothing but arterial blood gas analysis. So, it is a diagnostic test which measures the amount of oxygen, carbon dioxide, and pH level of the blood taken from the artery. So, coming to the purpose, it is to assess how well the lungs are moving oxygen into the blood and removing the carbon dioxide. It is a general phenomena. So, all human beings they have the oxygen and carbon dioxide exchanges in the lung. It will take place. So, this test will help you to measure the oxygenation and carbon dioxide levels in the lung. So it can be used common in the ICU, in the emergencies and critical care settings in the hospitals. So guys, please join to my live. And coming to anatomy and physiology basics. So the arterial blood gas is rich in the oxygen, whereas venous blood is rich in the carbon dioxide. So arterial blood is enriched in the oxygen, and main arteries used for this sampling technique. One is from the radial. Here in the hand we have radius and ulnar. So at that point we have the radial artery this side and ulnar artery opposite side. From the radial artery, the ABG sample will draw for the patients who requires, and brachial and femoral. So these are the very common sites for the taking the ABG sample from the patients. So the body maintains pH through respiratory and metabolic systems. So coming to the normal level, so let's move on to the normal levels of the ABG. If you see and observe on my screen, the normal ABG values, pH is 7.35 to 7.45 and PaO2 80 to 100 of mmHg. Coming to PCO2 means carbon dioxide 35 to 45 mmHg and HCO3, it is nothing but bicarbonate 22 to 26 milliequivalents per the liter and saturation SO2 95 to 100. These are the normal values for the ABZ. So if you are a nursing student or if you are a nurse, please quickly note down these points. It can help you to interpret in the ABGs in your healthcare sectors. If you already know this and revise summarize these interaction sections. So again, I am telling the normal ABG values. pH is 7.35 to 7.45. PO2 80 to 100 mmHg. Coming to PCO2, it is 35 to 45 mmHg. Soda bicarbonate 22 to 26 MEq per liter. Coming to last parameter, that is SO2 is 95 to 100%. It should be have to the patients. So all we have that one dot. Why the ABG indicated for the patients? So these are the very quick indications for the ABG. Usually, indications like respiratory failure, those the patient presented to the hospital with the respiratory failure, the first diagnostic test the consultant it advise is nothing but ABG. And if the patient is admitted or presented to the ICU or else to the ER, the first most important test is nothing but ABG. In the shock scenario also, the ABG test will do for the patients. And coming to the diabetic ketoacidosis, this is also very life-threatening conditions, whereas the patients admitted in the hospitals and dying within a 1 hour, 2 hour, 2 days, even the patients will recovering. But in the diabetic ketoacidosis, also the ABG is very essential. This is also one of the indication for the ABG. And move on to the another indication is kidney failure. Those the patient having the renal failure or acute kidney injury, so for the patients also, the advisable test is nothing but ABG. The kidney failure indications, we do the ABG. And move on to the other indication is nothing but severe infections or sepsis. So in this scenario, what will happen means the patients, those land upon the sepsis or severe infections, they need the ABG. Why means the acid-base balance will not properly take place in this patient. So that's the reason to measure the how the acid base level for the patient, the ABG will do for the in these situations. And last indication is to monitor the oxygen therapy and ventilator settings. Those the patient is on the ventilator. So usually what the patients getting the oxygenation on the ventilator. So how much uh, oxygen delivering to the patient, that has to be calculated to the APG. And few of the patients is on oxygen therapy means through the nasal pumps they receive the 4 liters of the oxygen per liter, and with the oxygen mask they receive up to the 10 liters. And few of the patients will receive the oxygen with the high venturi mask, that is non-breathable mask, 15 liters per minute. So those the patients on the oxygen therapy, they need the ABG test. These are the indications for the ABG. I'll move on to the another important aspect in the ABG. So ABG is not at all advisable for the all kind of the patients. As I mentioned in the indications, those the patient only needed for the ABG. It is not just like a routine lab test like CVP or RFT or so and so. The patients who need daily investigations, not just like that. But the few of the patients, those who require daily ABG, they have to do the test. And coming to the contraindications, so due to the ABZ, the local infections at the vein puncture site will be happen, and absent pulse or poor circulation will be happen, and bleeding disorders will be happen, and anticoagulation therapy and also will interact. Why means for taking the sample from the artery, the fellow nurses or technicians will do the repeated sampling at the same site, will do the bleeding and will cause local infections at the vein puncture if the staff are not maintaining the proper hand hygiene techniques and not wearing the gloves, and without gloves they touching the artery site and inserting the needle in the aseptic technique. This will lead to the infections for the patients. So for every procedure and for everything, there are certain equipment needed for the every procedure. So for as like that, for the ABG procedure also should have and ready with the few of the equipment. Those are nothing but ABG syringe with the heparin. Usually heparin comes in the 5 ml and 10 ml. So what has to do means empty syringe should be take and it should be heparinized. Means the heparin 1 to 2 ml should be loaded into the syringe and it should give it back to the heparin vial itself. And alcohol swabs, nothing but chlorhexidine gluconate alcohol swabs or sterlium swabs should be ready, and sterile gloves. As I said, sterile gloves are indicated for the ABG procedure because The needle what we inserting it directly goes to the artery. So the artery which carries the oxygenated blood to the all the body parts. So that's the reason the staff nurses, the technicians, those who are doing the APG, they must have to own the sterile gloves itself. And ice pack for the transport and gauze piece and tape. PPE according to the ward, according to the what is say situation, PP should be where for by the persons and sharp disposal, not even PPC containers. So the ice pack for the transport, why it is important means after drawing the blood, after drawing the arterial blood into the syringe, that should be transported to the lab within the minute or within the seconds. So once the blood is drawn from the artery, in the artery there are oxygen and carbon dioxide. If it is openly exposed to the environment, what will happen means the oxygen percentage in the syringe will be decreased. So cold chain should be provided for the of scenario. So that reason ice pack for the transportation it should be reached to the laboratory within the minutes and gas piece and tape. Why means after punching at the artery, after taking the arterial blood from the radial artery or femoral artery or brachial artery, the pressure should apply to the patients. It is not just like putting a plaster and doing routine work. The pressure should be applied, and it is very important to have a conscious mind. Those the patient on the heparin, those the patients on anticoagulant therapy, those the patient is on low molecular heparin, those the patient receiving warfarin. Why means their blood is very thin. For the reason, for the reason, gauze piece and tape should be applied. A tight pressure should be applied at the puncture site. And sharp disposal. Immediately, the needle should be dropped into the sharp disposal. Hello guys, where are you all? Please connect to my link here. There is no one in the what is say live section. So where are you from? I don't know, but please. So if you're first time to my channel, please do subscribe to my channel, like and share and support me. This is my new channel which I started for the enriching the what do you say, enriching the staff nurses knowledge by doing this kind of videos. And daily I will post the health related topics, nothing but fruit benefits and vegetables and weight reduction tips, all the health. Hi, welcome back to my live content. These are the required equipment for doing the ABZ. Okay, as I mentioned that, as I telling that gauze and tape should be applied to the ABG site, because if no pressure applied at the puncture site, the patient will experience a bleeding. That's the reason you have to put a gauze over that. The plaster should be applied. The plaster should be applied. And as per the hospital policies, needle stick injury prevention, the all sharp items should be discarded in the PPC container, puncture proof container. These are the required equipment. So move on to the procedure. Move on to the procedure tips. So any procedure as per the international patient safety goals and as per the hospital norms, the procedure should be explained to the patient. Without explaining the procedure to the patient, none of the test or any procedure should not be happen to the patient, because patient is the uttermost important person for the healthcare sector. So the reason, explain the procedure to the patient. How are you going to take the blood? What is the need for the collection of the blood from the artery? See, the blood collection from the vein and artery is very different. If you want to take the blood from the vein, you can find the vein very easily at the brachial site or antecubital site. But it is you taking blood from the artery. The artery is very different from the vein, because it is under the skin. It is at the radial junction, ulnar junction. No, 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 not ulnar. Radial junction and brachial junction and femoral point only. From these sources only you have to collect the blood. So the reason you have to clearly explain where you have to and what is the reason how to collect the blood from the artery. So the patients will experience a severe pain if you are not taking properly and repeatedly pricking and pricking doing to the patient. The patient will get the more pain. And anyhow, the patient is on ventilator or not conscious. So for the attendants, you have to tell, sir, I'm going to do the ABC. This is the purpose of the ABC. Anything, any procedure we are doing in the hospital should have to explain to the patient or to the attendant. So as this is very mandatory thing, first step, wash the hands and wear the surgical glove. And second step, position the patient very comfortably. The wrist should be extended. What all you need to do is the patient should be the patient should be very comfortable. The arm, the wrist should be extended like this. Okay, the wrist should be extended like this, and clean the puncture site with the alcohol. So you are going to hit the radial artery from here. So what we have to do is you have to wash the hands and tell to the patient and provide the comfortable position to the patient and extend the wrist slightly and clean the puncture site with the alcohol. Any type of alcohol. The all infection prevention practices or what is said recommendation is chlorhexidine gluconate solution. So we have to clean the arterial puncture site with the alcohol and locate the artery. Which artery is here, print here? Radial artery. Okay. You have to feel the radial artery. How the artery pulsation is. How the artery is bouncing. Whether it is very feeble or it is good. If the patients have the very feeble artery, if you are a very junior nurse or junior nurse about to learn how to take the ABC, don't try. Because in the cases of very feeble pulses, you cannot hit the arterial blood. That should be taken by the senior nurse only. Whether you're in charge or shift in charge or seniors, those who are very skillful in taking the arterial blood gas, arterial sampling in the situations. Or else, if they also can do the test, has to seek the anesthesiologist help. And then insert the needle in 30 to 45 degrees angle. Okay, the needle should be inserted 30 to 40 degrees angle, not like straight or upward or downward or equally. Okay, the needle should be inserted into the artery 30 to 40-degree angle. And this is very bad habit what I have observed in all hospitals and ICU. After inserting the needle into the what is said radial artery, the nurses will draw the blood. The technicians will draw the blood. This is not at all advisable. This is not a good practice. Why means in the artery there is some pressure. So please allow blood to fill in the syringe spontaneously. Don't take, don't draw the any type any blood from the artery. You insert the needle in the 30 to 45 degrees angle and leave it. Means hold it the syringe and allow the blood to fill the syringe spontaneously. No need to pull. Okay, this is very mandatory thing. This is very important point. Don't pull. Don't pull. Allow blood to fill the syringe spontaneously. How much you need? 1 ml or 2 ml or 1.5 ml. That's it. Don't pull. And then withdraw the needle, apply the pressure with the gauze piece at least 5 minutes. After withdrawing the needle, apply the pressure with the gauze piece like this, and at least 5 minutes, you have to put the pressure where you collected the blood, where you collected the ABG sample, whether it is at the radial artery or whether it is the brachial artery. If you hit the arterial sample at the femoral side, it is mandatory to apply the pressure 5 to 10 minutes, not just 1 second, 2 second, 3 second, or 4 second. It should be above the 5 minutes. And this is also very important. Do not do not give the chance to the junior nurses for applying the pressure at the arterial puncture site. Okay, under the supervision of the seniors, they can, but don't give the chance or don't tell to the junior staff, go and do the gauze piece with the plaster. No, 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 that is not at all a good communication. You have to tell brother or sister or technician, you have to apply a pressure at least 5 minutes at the radial artery or brachial artery or femoral artery. You have to observe any bleeding is happening. You have to observe any hematoma is happening around the puncture site. This is the communication has to forward to the where who is doing the that procedure should communicate. And after the blood collected in the syringe, so if there is any air bubbles in the syringe, cap it. Don't expose the needle into the air. Cap it and try to push the air bubbles. Okay. And seal the sample. Put a label of the patient, whether with the barcode or manually, and send in the ice box to the laboratory and get the ABC report itself. Few of the ABG missions will give the ABG report within the 1 minute, within the 50 seconds. So there is no need to wait up to 1 hour, 6 hours, or 10 hours or 12 hours. As most of the junior fellows who is joining in the hospitals, they are not knows how the ABC procedure and how the ABC sample will collect and how the what is the reporting purpose. If the senior fellow is if the senior nurse is very busy with the another patient, they will rather blood brother or sister go to the lab and give the sample. That's it. They will say no. Has to educate, has to communicate. You go to the lab, give sample to the lab person, and wait be there at least 1 minute. They will give the one slip ABC report. You have to bring it to me, and you have to show to the anesthesiologist. Okay, there is no need to wait for the ABC report. Just it is an instant report where the machine will give the one strip like paper. In that there are all parameters will be appear. Later that the lab people will do the abc what is that report in the letterheads. They will circulate. There is according to the hospital policies, right? These are the steps. So don't forget all the steps what I explained in the procedure wise. This is a this is a pattern. So abc is not just like as a early said, it is not just like a vein puncture. Okay, the senior nurse has to take the responsibility in the ICU in the ER. Then after the post procedure, okay, after the post procedure, apply the pressure at least 5 minutes. Monitor for the bleeding or hematoma, check the circulation, and document the procedure. Any document, anything what we did for the patient, that has to be documented in the relevant documentations. Clear? Hematoma means comment in my chat box and monitor the circulation. After the ABC collection, has to do the manual pulsation, has to do the how is the circulation is happening at the radial artery, brachial artery, femoral artery. The nurse has to do the assessment. If if any nurse or any person is missed the circulation pattern checking, that will lead to another complication. So this is very important thing as nurses in the ICU or ER, they will do the test and they will receive the one slip type paper. In that there are numeric test, numeric what is said, numbers will be there. So coming to the ABG interpretation, respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis. These are the very common words we can hear in the ICUs and in the ear, but we are not unable. Sorry that, but we are not able to know the what is the depth and what is the meaning of these things. Clear? And I will explain this in this. Okay, just now I thought that the entire ABC analysis or what you said, the entire ABC video cannot be happen in one single live section. So tomorrow I will take the latter part, interpretation, how the nurses should read the ABC report. All the things tomorrow I will tell. Up to now, is there any clarification need? And please comment my presentation, or please comment your name, where you connected, and please do the subscribe to my channel, like, share, and comment. Don't forget to subscribe my channel, and please support to my channel for better growth. With this mark, I am concluding my live. Up to now, there is one person is joined and going. Okay, let's see. So with this mark, I am closing my channel. If you find this is helpful, please like, comment, and share this stream. And do not forget to subscribe and do not forget to click on the bell icon. Then you will get all the notifications when I upload any video in the short forms or long video forms or this type of live sections. And my channel name is KP Health Hub Official. For more clinical insights, live demos, and educational content, please do subscribe my channel. So until next time, stay healthy, stay informed. Thank you so much, those who are connected to my channel.